Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this finally warm spring/summer morning. It's finally getting here. The sun's out. Life is good for a couple of days in a row. The Royals, on the other hand, we got to watch out for. But COVID still kind of got it back on its heels here in the United States. We're doing better overall. Hawkeye, how are we doing this morning?
Yeah. You know, we're good, doing good. Welcome back. It's good to have you back.
Oh, I like being here, especially if I can bug you. It's perfect.
Right. It's no bugging.
Bug the infectious disease doctor.
That's good.
It's good.
Hays has 0 patients. We have 10 total patients, 6 active infections, with 1 in the ICU but none on the ventilator, and then 4 in that additional recovery period. So continuing to see lower numbers of active infections being hospitalized.
It is so good.
Yeah.
Hey, our guest today is Vice President of RevCycle, Colette Lasack. She is here to help us better navigate COVID-19 medical bills and update what is covered by the CARES Act, because it's all just so clear, right? It's the best. All right, well, let me first talk to a couple of questions with you. Big article in the New York Times today demonstrating the relative proportion of people who are now dying. We still have a lot of people dying from COVID-19. We can't downplay that. What we're seeing is that it used to be those 75 and above. They've clearly fallen on their curve. 50 to 75 have risen. That's the highest percentage-wise of people who are dying from COVID now.
Yeah, and we know, a lot of that is because of vaccine hesitancy, or as Dr. Norman said, vaccine laziness.
Yes.
And just either not wanting to get it for one reason or another, understanding that they probably have a lower risk overall of complications, but not really understanding that they still have that risk of spreading it to others. And obviously, we're seeing that now as that other larger, more at-risk population is taken out of the mix because of vaccination. Now it's shifting.
Yeah, that's really, and it's the percentage of deaths because they haven't been vaccinated.
Right.
The overall numbers are down, but the percent of deaths and which proportion of that pie is the biggest no longer belongs to those 75 and above. Second big thing that I think came out on the Johnson & Johnson vaccine, pretty good data, even showing with variants that there's really good efficacy against the risks of serious hospitalization and death. And I think that included some stuff from around the world. I think it was 50,000 patients around the world or whatever. It's a good number. Just came out yesterday, I think.
Yeah, and again, I think it all has to do with not just the antibodies, but also that T cell, that second arm of the immune system that is activated with the vaccines. There was also a study that a viewer had brought up yesterday from the Cleveland Clinic, which maybe showed that there wasn't, you didn't need to get vaccination after infection. But I think there were caveats to that study. It is a preprint. It hasn't been peer-reviewed. 3 major caveats. It's a very small study. The second caveat being, we know that reinfection after natural immunity is low anyways. And so I think just understanding that, and then of course, the circulation of virus around that time as well. So very small study. I don't think that changes anything. You still need to get vaccinated after infection.
Yeah, so important. All right, so before we get into our discussion, it's time to bring in Adam Meyer, our Director of Nursing. He has 2 shots for 2 special young guests. Hawkeye, I think you know these 2 guests pretty well.
Yeah.
I think one of them is going to kind of come up to the table and switch places with you. Do you want to introduce them for us?
Yeah, so we can have Caroline come up first, and Caroline is my daughter.
Caroline. All right, Caroline, you know what's coming next, right?
She just graduated 6th grade. She turned 12 at the end of March.
All right.
So she's right at that eligibility age.
All right.
And now getting just her 2nd dose. So what happened with your first dose, Caroline? Did you have any problems?
I had a sore arm. My arm was sore.
But you came back for the next dose.
Yeah.
Well done right there. Congratulations. That's awesome. So, Caroline, before we get the shot, can I ask you a couple of questions? What's your dad really like? Is he goofy?
Kind of.
I would really think so. Is he grouchy?
Not really.
Really? He's never grouchy? Does he play with all those stuffed animals we see with him in the background sometimes? When he's, what is he? I guess those were really, those aren't yours, right? Tell the truth. Those are really Doc Hawk's. Those are his stuffed animals, aren't they? That's what I thought the whole time. I thought maybe he had something. There you go. So, Caroline, what's your favorite thing about school?
Seeing my friends.
Yeah, that's pretty good. Are you happy that you're back in person? I mean, now you're out because it's summer, right? But when you were back last fall or last spring, was that good?
Mm-hmm.
You like being in person better?
Yeah.
Yeah, a lot better. That's cool. What are you doing this summer?
I'm horse riding a lot, and I'm showing.
Horse riding and showing. Okay, that's something I could never have done. That requires a fair amount of coordination and skill, huh? Oh,
You
that's
need
really
to take
good.
pictures of that or video the next time. We
There
need
you
to show
go.
that.
There you go.
That's
Now, does your dad ride a horse?
No.
Can your dad even get on a horse?
Yeah.
He can get on a horse? Well, you hesitated when you said, yeah, that was a little hesitation there, Caroline. Okay. All right, so far we've learned your dad has a hard time getting on horse, but he loves stuffed animals with a unicorn, and he's kind of goofy at home. I think we would have guessed all that. That's pretty good. All right, well, let's get you a shot before I sing to you, okay?
All right.
Because you know that's coming, right? You knew the shot was coming, but you also knew a little rendition of Sweet Caroline's coming.
And I should say that, Caroline also has a common cough and cold. She got
Okay.
tested for coronavirus, and it was negative. But we know that those other viruses are circulating right now at this time as well. So,
Yeah.
and we've seen that, I think, throughout the winter.
Oh, and can I just say, I don't know about your patients, but in my outpatient population, we are seeing more people have colds as they take the masks off. There's just no question about it. We went through this wonderful period in the winter where our CF patients were just not getting sick, and now we're seeing it a little more often. But it's all about they're not masking anymore because they've been vaccinated. The mask mandates are gone, and we're seeing the rise just as we would expect. So it's out there still. All that other stuff, it's still out there. Okay.
All right,
And
you ready, kiddo?
I will say
Alright.
too, Caroline and Wyatt are getting the Pfizer
Alright.
vaccine
Okay,
this
so
morning,
we'll
which
get
is
to that.
currently
That's
our vaccine that's approved for 12 years and older.
And how has that been going so far, Adam? Have we gotten a lot of folks?
It's been going really well. As we have more kids headed to summer camp this summer, summer school. We are seeing more and more kids getting the vaccine, and it's going very well.
All right, well, you can't leave yet.
Oh.
What are we going to sing? Sweet Caroline. All three, love it. Bum, bum, bum. You have never been so good. So good. So good. We're feeling fine. Bum, bum, bum. And we hope you'll go out and dine. That was not very good, was it? That was a clunker.
Outdoors.
Outdoor dining.
Ride a horse.
All right.
Yes.
Have some fun out there. Thank you for coming in, Caroline.
And just like last time, we're going to keep an eye on them for 15 minutes. It's what we do in our clinics here whenever we give any of our pediatric age patients their vaccines as well. And just kind of as a reminder for everybody as well, we are offering the vaccine, the Pfizer-BioNTech, in our South Lake Clinic location, as well as our Prairie Village Pediatrics and our main campus Pediatrics. And we'll be rolling that option out in some of our family medicine clinics as well, too.
That is awesome. Well, Wyatt, welcome back to the program.
Thank you.
We're happy to have it. How you feeling today?
Pretty good.
How did you feel after your first shot?
I felt fine after my first shot.
No soreness, nothing like that?
No.
Okay, now here's the real question again. Do you agree that your dad is A, a little goofy, B, likes stuffed animals, and C, can't get on a horse? Are those all things? Are they pretty true?
They're all true, yeah.
Is there anything else we need to know about your dad?
No.
Not really.
No.
What does he eat for breakfast?
Usually, like coffee.
He eats coffee. I believe that.
Yeah.
I've seen that happen.
We need that.
Uh-huh.
Coffee's good.
That's good. All right. So do you like your dad?
Yeah.
Pretty good guy most of the time.
Yeah.
Yeah. Okay. Well, that's good. And you guys went some kind of cool trip not so long ago, right? Didn't the two of you go someplace?
We went to Chicago recently.
Yeah.
For soccer and saw my
Didn't you
parents.
go and you went to the Super Bowl, right?
Yeah.
Not such
we
a
went-
super game this year, but you got to go. That was pretty cool.
Yeah, it was pretty good.
Yeah.
It was
Were you
pretty cool.
surprised about that?
Yeah.
Yeah,
I was
that's
very
good.
surprised.
That's good. Well, just think, next time you get to go, you'll have been vaccinated. You can have your mask off. Things will be so safe. That'd be great, right?
Yeah.
All right. Well, thanks for coming in and doing this today.
Yeah, thank you.
And I don't know a song with Wyatt in it, so you're lucky about that. I guess.
So Wyatt will be going into high school next year, and so far during this pandemic, really early on, he had to be quarantined 4 times because of contacts, because we know that younger population was still getting together, even though there wasn't in classes. So there was some coronavirus that did get circulated among the friend groups. He was never positive, but I'm hoping now as he moves into high school and athletics and participation, this vaccine will be able to keep him to being held out from participation because he will be vaccinated.
That's awesome. Why, a couple of quick questions. Where does the red hair come from? I don't get it. Where was that?
Yeah, I'm here.
Yeah, maybe a few years ago you had it. So, are you taller than your dad now?
No, not yet.
Okay. Is it coming?
Hopefully.
All right.
Hopefully.
My son wanted to be taller than me. He stopped about a half an inch short. It was great.
All right, let's do you. I'm gonna have you put that arm down by your side and just relax for me. There you go.
Why
Can
don't you
hold
tilt
that
his
seat?
chair just a tiny bit so that we can get it and see it going in.
Well, Adam, so we've given quite a few shots to folks who are 12 and older now, and that's got to be pretty satisfying to our staff to see these young kids coming in and
Yeah.
wanting to be vaccinated.
Yeah, absolutely. I don't have exact numbers with me today, but yeah, again, we're hearing a lot of parents
All right,
that
you're
are
set.
sort of breathing that
Thank you.
sigh of relief of my kiddo gets to go to summer camp now, and so yeah, it's been a really positive experience.
Great. So, are you going to be another infectious disease doctor someday, do you think?
Maybe.
That'd be pretty cool. All right, I want to say thank you. Do you like, what's your favorite sport?
Probably soccer.
Soccer's cool. That's cool. Sporting's off to a good start this year. Gotta like that.
Yeah.
That's really been fun. All right, and school, good to be back in person.
Yeah.
What are you doing this summer?
A lot of sports and camps.
All right, good fun, huh?
What's your
Yeah.
favorite college team?
Missouri.
Oh, M-I-Z?
Yeah.
M-I-Z?
ZOU.
All right, there you go.
Yeah.
So I'm what's called a Tiger Hawk because I grew up clearly as a Missouri Tiger, but I've been in KU now for 31 years. Kind of like KU too. See, it's possible to like both. It's just unusual.
Yeah.
All right. Thank you for coming in today. Thanks for doing that next shot. Good luck. Stay safe out there.
I think we can get Anthony and Logan to edit out the MIZ. Mark that and edit that out.
I could do a rock chalk chant too.
That'd be good.
All right.
We need that.
All right. So let's see if there are any reporter questions out there today.
Hey, good morning. Cody Holyoke with Channel 9.
Hey, Cody.
Hey, so Moderna this morning just announced that the company filed for an EUA for their vaccine for kids 12 to 17. And I was curious what you think this means for the fight against the virus. And you touched on this a little bit just a few minutes ago, but are you seeing vaccine demand growing for that age group, or how is that compared to the rest?
Yeah, those are great questions. Hawkeye, I think I would like to say it's a breakthrough moment because Moderna is going to have this vaccine.
Yeah.
But the simple truth is right now in the United States that we have more vaccine than we need.
Yeah.
And we are watching some vaccine expire, which just is terrible to say for those of us in the health profession. We hate it when stuff like that happens. Because what it means is, and we know that across the world, people can't get vaccinated, and we have vaccine expiring. I think it's great for all of us to have that indication that you can have more than one kind of vaccine for those who are 12 and over. And I hope it goes down to a lower age. I believe that it will in the very near future. Yeah. But it just brings to mind that we can't get enough people to be vaccinated, and that's a concern for us.
Yeah, I think, like you said, we are very fortunate here in the United States. We have an excess supply of vaccine. We don't have that demand. But we know for children, although their risk of severe disease and death is much lower, they have that risk of the multi-system inflammatory disease. And even if you as a parent don't feel that you're at risk of problems, you certainly don't want to give your kids excess risk of issues. So we know that coronavirus can cause that as well. And like we said, as you move further into this, we know that vaccine will also allow them to continue to participate in sports. They won't have to quarantine. They won't have to be held out or any extracurriculars. So I think overall it's a good thing. The more vaccines that we can get authorized or approved for the youngest populations is going to be better. Overall, it will help stop the decrease, or it will help decrease the spread of the disease.
Yeah, agreed. And then I think there's a second part to your question.
Well, I was just curious with the vaccine demand, because we've seen it wane, and that's like the understatement of the summer right now. But with this age group, are you seeing more parents interested now, or since it's been approved in Pfizer for a while, that it's starting to drop off in that age group too?
Why don't you step over here?
Yeah, I'm going to turn to Adam because I think, Adam, you're helping monitor this a lot.
Absolutely.
And what are your thoughts about that question?
Well, I didn't hear it. I don't have anything to say.
Okay. So I think the question is, are we seeing this age group, 12 to 18, are we seeing people lining up to get that vaccine, or is even interest in that age group kind of died a little bit?
I think, we saw, as with the vaccine, we saw kind of a big uptake right in the beginning, and now we're starting to see that taper off. Again, kids and parents that were getting ready for summer camp, getting ready for summer school, filled some of those very early appointments, and now we're starting to see some of those numbers taper off again. So very similar. Now, what I will say is we saw at our vaccine event at the Speedway over the weekend a couple of kids that actually brought their parents with them that were vaccine hesitant and said, I want to
Good
get the
for them.
vaccine. And we were able to vaccinate the whole family, which was really rewarding experience.
That is great.
Yeah.
All right.
Yeah.
More Speedway events, right?
That's right, yes.
All right. Hawk, what do you think about it? We are seeing a wane.
Yeah, I mean, I think overall there is a waning of that want and that need to get the vaccine. But I think if we want to continue to have schools open and not go back to what we were, and also keep everybody in that school safe, the children, all the adults in that school who are teaching our kids or counseling our kids, doing all that kind of stuff, I think it's important for everybody to get vaccinated because, again, you're only as strong as your weakest link. And we see that whether in the microcosm of our community or the microcosm of a school, but also in the concept of the whole world. And that's why we see, the U.S. is now buying doses of vaccine for the whole world because, just as you said, there are countries that would do anything to have the ability to get the vaccines that we have such a large supply of right now.
Yeah. Other questions?
And that actually forays into a question I was going to ask about. President Biden expected to announce today that the U.S. is purchasing 500 million Pfizer vaccine doses to donate to other countries. And as you talk about variants these past few months, I'm curious what this could mean in the overall global pandemic.
Yeah, you bet. So it is a great thing, right? I hope we can get 2 or 3 billion doses out there because the reality is this. The virus mutates when it infects people. It doesn't care what country you're in. And it most certainly, as we've said before, it does not respect national boundaries. It doesn't respect state boundaries. It doesn't care how much money you make, what race you are, what religion you are, what your gender preference is, how tall you are. It doesn't care. When it infects people, it mutates. The only way to really get rid of this worldwide scourge is to try to vaccinate as many people as possible so that the virus can't get in, reproduce, mutate, and spread. Because even if we've been vaccinated against today's variants, the alpha, gamma, delta, whatever the heck the Greek alphabet is, we may not be vaccinated against tomorrow's variant. And the only way that we can all stay safe is we have to all stay safe. And we all stay safe by all being vaccinated. I think it's a great thing what we're doing. Yeah. I hope we do a lot more of it. I applaud the president and the administration for doing that because it's just the right thing to do, Hawk.
Yeah, and I think more to the point of just global health. We know that when the pandemic hit, other infrastructure and health programs were shut down. This will allow people to get back to those things, such as polio vaccination campaigns, HIV and AIDS treatment and prevention campaigns, get back into those harder hit societies now that we can, curb this COVID-19 pandemic, but also start to work on those things that were worked on even prior to the pandemic.
And and we didn't even touch on the economic impact of this because if you think there is a worldwide supply shortage for different supply chain things, you'll know this much better than I do, Colette, so I'm going to turn to you about it in just a second because we'll talk about how it's impacted healthcare. But as you look across the world, the only way to make sure that we really get supply chains geared up is to keep people healthy. The only way to keep people healthy is to get them vaccinated. The only way to get them vaccinated is, no shocker here, they got to have vaccine. So I think it really helps. It can have a major impact on our own country, not only from a health standpoint, economically too. Do you have thoughts about that? Because I know that not necessarily supply chain, but do you have more exposure to that part of the world than I do?
Yeah, I think absolutely. The more we can keep people healthy, right, and keep businesses open and make sure that in turn patients can even have the insurance that they need because they're employed. So, yeah, it's so cyclical. So absolutely, I think the healthier we can keep people across the world, it absolutely has an impact on all of us every day.
Yep.
And that's been borne out and shown in studies. People think, well, it's just the natural living and dying process, but that's not true. Actually, countries that have healthier populations are more productive and have those supply chain and that workforce, so it's very important.
Other questions today?
KCTV5 had 2 questions. Joe Chioda wants to know, he noticed that in Houston and Maryland that people were, hospital workers were walking off the job when they were told they had to get the COVID vaccine. He wants to know, are we going to require our employees to get the COVID vaccine?
Yeah, that's a great question. What we've done so far is say, look, this is under an early use authorization, and even though there have been over 1 billion shots or 1.6 billion shots given worldwide, we've given, 90,000 here in the health system, and really it's an incredibly safe drug. We don't intend to go down the road of requiring it for our employees until it's fully authorized by the FDA. Now, Pfizer has gone pushed forward for their full authorization, as has Moderna. But until it's fully authorized, we really had not intended to do that under an early use authorization. And what's our percentage of people now who have been vaccinated? Adam, do you know?
Here within the health system.
Yes.
Gosh. I believe I can't. I tell you, but I don't want to mislead you with the numbers.
We'll find out.
Yeah,
and we'll
yeah,
know that
we'll
in the
get
near
those numbers
future.
and bring them back.
But I think it's a good percentage. But there are people who have been hesitant and vaccine procrastination or whatever. But I think we will eventually require it of our folks. But I think we want to get it fully authorized before we do that. Fully approved. The second thing I would just add to that is when we look at our influenza vaccination, when we first started doing that, we had some people who were resistant to it, and we have like 15,000 people or 14,000, whatever the number of employees. It's approximately a very large number. Last year, 33 people didn't get vaccinated for influenza. 33. And most of those had really good reasons to know. I think probably all of them had very good reasons to not be vaccinated. And I think we hope to get there on the SARS-CoV-2 vaccination because, again, it is okay. It is safe. It is the right thing to do. And once it's been fully authorized by the FDA, I think that's a story we have to tell.
Yeah, it's proven, the vaccine's proven to be safe. They are morbidity and mortality saving, meaning they are illness and death saving measures that we can take to do this for our employees, for their families, and for our patients as well. So.
And the second part of his question may be moot or already answered, but the second part is, will we require new hires to either show proof of vaccination or be willing to get vaccinated?
I think it depends. We don't do that today. And I think that question will come up once it's a fully FDA approved therapy. Then I think they would be treated as any other employee. You can either prove that you've been vaccinated or you get vaccinated when you get here. And I suspect that's the direction we'll go. But we haven't made a final decision on that. We're waiting for the vaccine to be fully approved and make sure we've had the chance to have our ID team review all the information and all the data around that. But so far, the data looks remarkably good.
Astoundingly good.
And just a quick update, we're right around 60% of our
Okay,
employees have been
60%.
vaccinated.
So
Yep.
we'd like to be in the 80 or 90% range. We had a higher percentage, I think, than some of our clinical folks, but our overall employee rate, 60%, we need to get up to 90, 99% like we are around influenza. And, I do understand that people want to be hesitant. They want to see what's going on with it. What I would just remind all of us is that we can't get out of the crisis until we really get out of the crisis, which is the risk of variants drop dramatically. The way the risk of variants drop is to get everybody vaccinated, and that your own getting infected with COVID-19 doesn't necessarily protect you against all the variants. That's been shown. It certainly improves the risks, but it's been shown around the world that you can still get reinfected and you can die the second time. So, any other questions?
That's all for reporter questions that I have.
All right, Colette, I got some questions for you. Here we go. This is going to be fun. I want you to explain the CARES Act and all that stuff to us.
The CARES Act.
Or whatever. I mean,
30 seconds.
This whole thing. What was it we were supposed to say? You're going to talk to us about medical bills and updates. What's covered by the CARES Act? I still don't understand it.
It's complicated, right? It's
is.
complicated for patients and complicated for us. I think the one thing that we always say from the outset is we definitely think it's been a huge blessing in the United States that we have had from Washington, right, the approval for the first time in my career to cover uninsured patients regardless of any status for the testing, the treatment, and the vaccination in regards to COVID. So pretty easy said, a little bit more difficult
It's hard.
to
It
make
is a little
that happen.
challenging. Yeah.
So very quickly that program got set up. Pretty good direction to us as healthcare systems how to participate in that. A little bit clunky getting it going. I think that the biggest thing that we're dealing with now is really, as we always do, is to educate patients, right, from a financial perspective, to make sure that they can obtain coverage whenever possible. You know, Steve, you know that we've got a large number of
uninsured patients.
financial counselors to help patients do that every day, and not only for uninsured, but also for the underinsured. So that's the biggest message I think that we want to get to people. If you have a problem with your bill or if you have a question, call us.
Yeah.
We're here to help. We've got our numbers easily available on our website. You can also contact us via the web on MyChart. So we're always here to help and to make sure that we can help you get the coverage that you need.
And you and your team have a great heart. I think you guys do great work, and I mean that. My patients are calling you, so I get feedback. COVID-19 has left many patients and their families with huge medical bills. Does the CARES Act help them, or is there any other way to help those families?
Well, a couple things. We always want to make sure some of our patients come here and are much more complicated than just COVID. So we want to make sure we really understand those bills. And in fact, Jill and I worked on one together just not too long ago. But some of those bills can be catastrophic.
They're huge.
Catastrophic. I mean, over $1 million if you're here for any length of time. And as
Isn't that mind-boggling that you have, I mean, it's tough.
it is, because the intensity of the care, right, is just unbelievable. But it's absolutely making sure that we can help those patients wherever we can, whenever we can. And it's not just the CARES Act, right? We have marketplace plans available now for a longer length of time than we've ever had before. They've extended that. We've got folks here to help patients get on Medicaid if they are eligible for that. So, and if not, we also have extended payment plans. We have discounts for our self-pay patients that cannot get insured. So we have a whole array of programs. We're really here to help patients get the care they need.
So one of the things that I'm sure happens is that people get surprised by their bills. What's the most common question or reaction you get from the size of these bills?
I think the most common question is, gosh, I thought this was covered, either by my insurance or by the CARES Act. And help me understand that. So we've even extended our call center hours in customer service to make sure we can be open for patients when they need us, to really help answer those questions and get them the help they need.
So does the CARES Act actually help pay for anybody's bills if folks are underinsured or don't have any insurance?
The CARES Act only covers for patients who are uninsured. They do not help in any way for those that are underinsured.
Which is a real problem, because some of
Which
those
is a real
insurance plans
problem.
are
Super high deductibles, things that patients can't afford. But we're also very used to dealing and helping with patients that have high deductible plans. So don't avoid it, right? Get on the phone, call us, let us help you. We try our best for any patient that's inpatient with a high deductible out-of-pocket expense to talk to them before they leave. But if that doesn't happen and you get a bill at home and it's not what you expect, call us. We are here to help.
So this long haul syndrome, is that affected by the CARES Act at all?
Oh my gosh, my favorite topic over the last couple months.
It's hard. Well, it's not my favorite topic.
Yeah, so long haulers is kind of a topic, and Hawkeye can probably talk better to this than I, but it's those patients that are still having symptoms post-COVID, and we have no indication at all from HRSA that they're going to cover that. It's only if COVID is the primary diagnosis. So when these patients come back, they're no longer COVID positive.
Correct.
So we're appropriately coding them by their symptoms and what we're treating them for. So we have weekly touch bases with HRSA as well as outside consultants to help us push this issue to say what is going to be done, if anything. So we give that information to patients up front. to really help them. And again, how can we help you with the longer term of getting you on insurance or getting you some appropriate type of coverage?
You know, our team has been kind enough to post this up on our program today about no health insurance, need COVID-19 services from the from HRSA, and it's just kind of helps you walk through and gives you some ideas about what you can do. Has that been helpful to folks, do you think?
I think so. We've really helped this in just our campaigns to educate patients. It's actually out on the government website, and got those connections out there.
I like those
so-
cool capes on some of the people.
Yeah, the
Most people
capes.
think we have horns, but
Yeah.
you know.
But I think the great thing for this is, you know, regardless of your immigration status, if you are in the United States, you will be covered for COVID. Again, testing, treatment, and vaccine.
What should I do if I believe my primary diagnosis with COVID-19 and my bills should be covered? Who can folks talk to again? Tell us about that.
Actually, if they call our customer service center, and I think we're going to put the number up there for folks, our financial counselors are always available, but we will absolutely go back and look, again, take a second look at those accounts and make sure how are they coded, are they appropriate, and is there any appeal process we can take to help get those paid?
Yeah. So, do hospitals get paid for COVID? Because if I was a patient, I'd be thinking, well, you guys are making a lot of money off of COVID-19, and now you're charging. Or how are we doing on our COVID reimbursement?
How are we doing our COVID reimbursement? Takes a while, especially with our larger dollar inpatient accounts. So we are tracking that. Again, they're basically paying at Medicare rates when they
That's
pay.
not a great rate, by the way.
Not
Just
a
in case
great
anybody
rate.
knows out there, we don't make money in Medicare.
Not a
we lose
great
money in
rate
Medicare.
at all. You're right, Steve. It's not a great rate, but at least it's something. And prior to having the CARES Act, we wouldn't have been able to get paid on those patients at all. So at least it's something, and to really help that. But there really isn't any other help for the patient out of the CARES Act other than help with their medical bills.
So none of the doctors are becoming millionaires from writing COVID in the chart, is that right?
Unfortunately, no.
And neither is the hospital, let's be clear.
No, and I think, again, it just speaks to the intensity of the care when we're seeing these catastrophic bills for the patients that are inpatient, as you know, for weeks and sometimes a couple of months at a time. It's unbelievable.
So some people have had COVID, are underinsured, may not be insured, and then they could be economically devastated by that, not just health-wise, but economically devastated. Is that a fair comment about
I
some
think it's
folks?
absolutely a fair comment, and we are definitely seeing a rise in helping patients, when applicable, apply for disability, because that can give them additional income that way. So that's another thing that our financial counseling team helps with, free of cost to the patient, is to explore those possibilities for them.
Without sounding to be too Machiavellian here, think about vaccination then as not only potentially saving your life, but saving your pocketbook.
Absolutely.
I mean, it really
Absolutely.
I think if we put some of our patients through here, we should ask Neil about whether or not this has impacted him financially. And, you know, you may say, I don't want to be a believer, you know, the politicization of this disease, which just drives me crazy. But at the end of the day, do it for yourself, do it for the family, do it for the folks you care about, do it for your own economic health. Even if you don't want to care about your personal health, the medical health, think about your economic health, because COVID-19 can kill you in many ways, and that is not the person you want to be.
Or the stress impact of just looking at those bills.
Yeah,
Oh, absolutely.
that would be so. That's just terrible. Jill, I bet we have some questions.
We do. We have a couple. Mary wants to know, have you run the numbers on the average cost of COVID treatment patients that they're not responsible for? Have you run the numbers on the average cost of COVID treatment patients are responsible for? Not covered by
Let's
insurance.
back up the question. What's the average cost of a COVID admission? Do we know that?
I haven't pulled those numbers, but I'd be glad to pull that, Jill, and get back
Let
to
us
you
know.
so we can have that.
And we might want to separate that both into just a routine hospital admission and those who are admitted to the ICU.
Yeah, there is a distinct difference
Yeah.
for those that are inpatient in ICU.
And, you know, having been
Absolutely.
an ICU physician for over a quarter century, one of the things you don't do is spare the resources when people are dying.
Absolutely not.
And so, you know, you're not thinking, I got to do this because it's the right thing to do. That I said that wrong. You don't not do something because of the cost. You only are trying to save a life and hoping that the cost side works out later.
Right.
And, you know, it's man, ICU care is a different beast.
Laura wants to know, does the CARES Act assist a patient who had a bad reaction to the COVID vaccine and had to be hospitalized?
Well, first of all, that's just intensely rare. Let's just put it out
Yeah.
there. Great question. Intensely rare. That's that question that I get afraid sometimes that people get so hung up on vaccine side effects
Yeah.
when the side effects of COVID-19 are just so much worse, and the risk of death is so much higher, that it feels hard for me to try to, you try to make sure, but we want to answer the question and be honest about it. So if you have a shot and you get really sick from it, does the CARES Act cover it? I mean, your insurance would cover it if you have insurance, but if you don't have insurance, then what would happen?
Right, again, I mean, the CARES Act is about vaccine treatment.
Yeah.
And testing. So I think we'd really have to look at an example, Jill, to really know, to be super specific. I'm trying to think in my head how we would even code that from that perspective. So again, it's going to be an allergic reaction. I don't know that there's going to be anything specific in there about COVID. So
So I just want to call timeout because I see Adam looking at me as if a certain clock has run out, Adam Meyer.
Yes.
Tell me
15
what's
minutes
going on now.
Yeah, 15 minutes are up. So Wyatt and Carolina, you guys feeling okay?
Yeah.
Feeling good?
Yeah.
Okay. Drink
All
lots
right.
of water today. Move those arms around.
Cool. And do you have to wait someplace for your dad? Or are you just going to hang out with us because we're so cool to hang out with right here? That's because they didn't acknowledge how cool we were. Colette's cool.
They avoided it and just said they'll hang out.
Yeah.
Couple of more questions?
Please.
All right. Darlene, this might get into an opportunity to talk about coding and certification because she says common sense ought to tell you when something is COVID related, like your long haulers, and that was kind of the case with the gal
Yeah.
that came in through the ED that we worked on her bill.
right, exactly. So fair question, right? Sometimes logical sense doesn't align with our coding rules. So
Just to see, because coding rules aren't always logical. I think, is that okay for me to say
it's
online?
totally
outline?
okay. Now, they're logical in a different way.
Yeah, I suppose that's
So I think it's important for the public to understand that we adhere from a compliance perspective to make sure that we're following national guidelines for coding. And so that takes into effect a lot of things, including the bodily systems and what is actually going on with the patient. So we've had instances, Jill and I worked on one just about a month ago where, and this has happened a couple times, where patients are so sick from a COVID perspective, but they're septic. So when we go into those coding rules, sepsis always becomes the primary over COVID. So we've had to work our way through that with HRSA. To make sure that those bills can be appropriately and compliantly submitted, and that we can get reimbursed for those. So it's important that we follow the coding rules and really look at everything that's going on with that patient. It may seem to the common person, oh, this is obviously COVID related. When we really get into the medical chart, it can be much more complicated than that.
But you did go to bat for that patient. The other thing about that story too is that I found super interesting was this patient came in very sick. They don't know why she's septic. They figure out it's COVID. Then they found out she had cancer. And we treated her for cancer while she was on a vent. She survived both.
Can't get much more complicated.
I
I was
know.
going to say, that's a tough story.
That was a tough story.
But in some ways, a miracle story because they found the other diagnosis and the team found the other and was able to offer therapy for that. All right, couple more questions. We're going to be done.
Okay, Susan wants to know, do all hospitals have financial counseling teams like you?
I would tell you in my years of experience, the vast majority do. I think for large health systems like ours, we're very blessed to have such a large group of financial counselors to really help patients. But some of the smaller community hospitals do struggle to be able to staff that. It's an administrative cost. You don't get reimbursed for having financial counselors. So I would say that the majority do.
Okay.
Got to be your own advocate.
You have to be your own advocate.
Okay, a couple of COVID questions before we go.
I love the way she does last questions. And it is, I got a couple of them, but they're the same ones, so they're going to wrap together.
Okay, well, Gene says, who's also a very faithful viewer, we appreciate you so much, Gene. He says, I just assumed that healthcare providers were all vaccinated. I guess I'm wrong to assume that?
Yes, you're wrong to assume that.
Yeah.
And that's why some hospitals early on said that they're, actually not early, but recently have said that they were going to require all employees to be vaccinated under the EUA because they believe that was safe. And I think you can make a really cogent and very good argument for that.
Yeah.
We've been reluctant without FDA authorization, but some hospitals and some big ones like Texas Methodist have forged ahead. And you know what? They got most of their folks vaccinated. And so hats off to them. And I think that, but nursing homes have not gotten there. They have 45 or 50% of their staff vaccinated. A lot of people are around that number. And I think it's not that dissimilar from the American public. And so, we continue to forge ahead and trying to get more and more folks vaccinated. I think, again, we'll end up requiring it and once it's FDA authorized, I suspect. But for right now, we look like America, don't we?
All right. Melissa has a lot of questions about kids and vaccine. I don't have it on your promotion for tomorrow, but I just want to take the opportunity to say I'm working really hard, and I'm about 95% sure I'm going to have someone from Children's Mercy join us tomorrow to talk about vaccines and kids. So hang on, Melissa, and tune in tomorrow. The last question I am going to give to Arietta, who wants to know, now that masking requirements have been removed, or I guess they have. Are religious gatherings like attending and participating in mass safe? And how about weddings? How large can the party be?
Mm-hmm. Good luck, Hawk.
Yeah. We can't tell you how safe. It goes back to understanding, as Dr. Stites just said, understanding that not everybody is probably going to be vaccinated. So understanding the benefit and risk of doing these things. We still know that vaccination is extremely important for reducing the spread of the disease, but also those other non-pharmaceutical interventions like masking, like distancing. Even though those restrictions are lifted, the virus is still out there. You can still take those precautions individually to do what you want and understand the risk and benefits of doing things. If you are going to those large gatherings, try to be outdoors if you can. Mass, I think different parishes, different churches do have different rules. Some are still making you go in with a mask. So it's just kind of understanding that environment that you're in, understanding the risks. And you are still welcome to distance as much as you can, to mask, even though overall restrictions are lifted, to do those types of things. But most importantly, individually, get yourself vaccinated.
Such good words, such wise words. So, hey, tomorrow is Follow-Up Friday. You just heard that from Jill. And Lance Williamson, Infection Prevention Control Nurse Supervisor, will be here to help answer your questions. We'll also hear from Chelsea Smith with the Community Blood Center, who late yesterday issued a blood emergency. They were down to 3 days of blood supply, and the normal is at least a week. We continue to battle that, so we'll hear details about that tomorrow. Hopefully we'll have somebody from Children's Mercy on with us. All right, team, final thoughts. Colette.
We're here to help, right? If you have a question, if you are surprised by anything on your bill, give us a call. We're here to help.
Adam Meyer, final thoughts today.
Encourage everybody who can to get vaccinated and stay safe.
All right. Caroline and Wyatt, final thoughts today. I saw you looking at your phone. Gotcha.
That's all they do.
Final thoughts, you guys? Anything? You guys both feeling okay?
Yeah.
All right, doing all right. Good deal. What are you going to go do today?
I have to go to the dentist.
Oh, man.
Oh, a shot in.
And the
Dentist.
dentist
Nice.
in the same day.
Wyatt, what are you going to do? You going to hold your sister's hand while she's at the dentist?
No.
No, fine.
I'll have camp. Yeah, camp.
All right, good job.
Yeah.
Thanks for your helping have your kids vaccinated.
Oh, it's awesome.
That's very generous.
I think it helps me. Vaccinations are safe. They're extremely effective at stopping illness. We want to keep schools going. Get your kids vaccinated. This is important because I want my kids to be at school. Other children, they are safe places. They are places where they can get lunch. Getting them out of the house is most important as well. Getting them in those social situations, just as they were pre-pandemic. So it's very important. And to keep the economy moving, to keep schools open and restrictions lessened, vaccinations are the way to do that. We can do this moving forward for the next school year. Hopefully, even the younger children will be able to be vaccinated. But please get yourselves and your children vaccinated and help keep the economy, the schools open, all of that going, just as we have started. doing a pretty good job of it, but still need to get more vaccination. And we are giving, just as Adam said, we have a lot of vaccine here at the health system. So please get your COVID vaccine. You can call here, 913-588-1227, or go to the kansashealthsystem.com /vaccine to try and set up and schedule a visit to come and get vaccinated.
Yeah, really good advice. So, hey, as we end today's update, a great way to avoid big medical bills from the complications of COVID-19 is to get a free vaccination. The shots, remember, are covered by the CARES Act, and we have plenty of vaccine. You can book an appointment by calling 913-588-1227. Go to MyChart or log on to kansashealthsystem.com /vaccine and follow the prompts. Remember, you don't have to be a patient here to get a vaccine here. We'll vaccinate whomever, wherever. We just want you, and we want your arm. You know, we've had a lot of conversations with you during this pandemic. We've always tried to shoot square and be honest. We weren't going to be flapjackers. We talked about faith and hope and science, and now our belief resides with you. We hope you make the right choice for yourself, your family, the world, and yes, even your own pocketbook. We'll be back tomorrow to answer the questions. And while there's still no place like home, getting out safe, you know what? That's a hoot too. We'll see you soon.